So just finally going to turn to Lara Edwards. Lara is a Senior Programme Manager at Health Data Research UK, has been responsible for shepherding the really important data and connectivity workstream of national core studies. And Lara, I mean, a very warm welcome, and it would be great to hear your perspectives as a funder, and also how you think this has kind of helped the national response to the pandemic. So Lara, thanks so much.
Absolutely, thanks Aziz. So yeah, really interesting talks today, and it's been really fantastic to see the kind of ongoing process and progress and really impressive impact of this work, Aziz. In particular, it's great to hear from Jill in the beginning how public involvement has been central to the project and research priorities, and I think that is a real strength actually of DaC-VaP-1 and DaC-VaP-2. And just to kind of highlight, there may be some of you in the call who aren't completely familiar with the National Core Studies or Data and Connectivity, which has funded some of this work. And really, data and connectivity is one of several national core studies which were set up at the beginning of the pandemic by Patrick Balance, really to ensure COVID-19 research could be addressed at pace to inform policy response. And importantly, a key requirement of all the national core studies is that work is done at a four-nation level. And the specific aim of data and connectivity, which was led by HDI UK, the ONS, was to really bring the UK-wide health data community together to really enable access to priority data sets across a trusted national trusted research environment network. And in addition to that, and in parallel, one of our key aims as well is also to really enhance the UK-wide infrastructure and leave a long-lasting legacy beyond COVID-19. And I think you can see today, obviously, that the DaC-VaP team have really demonstrated that their work completely aligns with the aims of HDI UK, but also the aims of the National Core Studies. And I think, importantly, key to our decision to fund both DaC-VaP-1 and 2 studies was this four-nation approach that's been described today, and also the innovative analytical approaches taken. It really was doing something new, and I think that's been really important. And the impact of DaC-VaP has been significant and informed, obviously, not just UK, but international pandemic response and policy. And it's been singled out numerous times by our funders, UKOI, HDI UK and others, as a true exemplar of the national and international collaboration that continues to produce extraordinary volume of rapid outputs and continues to inform governmental decision making. So I'd say just huge well done and congratulations to all of the teams across the UK. It's really been an impressive initiative. And I guess maybe just to finish, I think a key challenge that we're kind of grappling with in national core studies and the wider research community will be how we really ensure we maintain the legacy of what has been achieved in the last 2 years, because much of which would have been unthinkable pre-pandemic. And that includes the kind of UK-wide infrastructure that's been assembled, but also the collaborations and communities that have been built up, such as in DaC-VaP, that have enabled this kind of really rapid and policy-relevant research to happen. So ensuring we don't revert to old ways of working is a key priority for the National Core Studies in HDI UK more widely. So it'd be good to kind of get your comment on that also, Aziz. But just to sum up, really, we look forward to obviously continuing to work with Aziz and the four-nation DaC-VaP teams as we tackle these kind of specific challenges around legacy and ensuring that we maintain this infrastructure, but also seeing the ongoing outputs and impact of the research, and of course supporting the teams to enable wider access to these highly valuable data sets. So yeah, just absolutely well done. It's been an amazing initiative to work with. Thanks, Aziz.
Brilliant. Thanks, Lara. Thanks so much for your trust and your support, really, of the team. This has been challenging work, but we're very, very grateful for your support and guidance kind of throughout. So we're coming to the end, and just a few final comments. The first thing to say is really just an enormous thank you to all of our speakers. So that's Jill, Simon, Stephen, Stu, Declan, Chris, Tristan, Jenny, and Lara. These things don't happen without a lot of kind of preparation work and groundwork behind the scenes. So Gabby and Lorna have been absolutely fantastic in that respect. So an enormous thank you to the two of them. There are much wider teams involved. So, I mean, a few people have been speaking on behalf of teams. I mean, some of those colleagues are on the call, but even if they're not, I mean, I think incredibly, very, very grateful really to all of the colleagues, because what we've been trying to do is, do work in the national interest at speed and at scale and with precision. And I think, there's been a lot that's achieved. Going forward, we're very keen that people do come forward and knock on the door and ask about how they can get access to these data sets, and we'll do our very best to try and support, because I think certainly this is comparable COVID cohorts have been established in all 4 UK nations. We've got methods of working to undertake harmonised analyses, and so very, very keen to support others coming on board. Going forward, Lara, what we're trying to do under Jenny's leadership is thinking about generating comparable cohorts for other respiratory disorders in the first instance. So there's work going on around asthma, COPD, interstitial lung disease. Ideally we can do this on a 4 UK nation basis. There are obviously other respiratory tract infections, pneumonia, influenza, RSV that we're also very keen to do. So I think hopefully we can build on this important legacy that's been laid. So there's a lot of work to do, and the more we can encourage colleagues to get involved, roll up their sleeves and contribute, you'll all be very welcome. Finally, can I just thank you all for joining? It's been a bit of a whiz around the UK and beyond. Hope you found it of interest, and look forward to hearing from you in due course. So thanks everybody, see you soon, take care.